The other reason is to counter the physical deterioration of the body. What do? We eat as much as we want. We drink as much as we want, okay? We party, we do everything. At the end of the day, when we are rich, we think cosmetic surgery can take care of all of that, okay? They can make us look young and feel young and everything. The other reasons is very genuine medical reasons. When you have accidents, burns, when you have misaligned nose bridge and other congenital physical defects. The other reason would be to be very competitive in the corporate world, not only in the corporate world, but also in the film industry. Or, most of the actresses want to look really good. They have all these, breast implants, liposuction. It's a very, very competitive field, as we all know, the film industry. And the other reason would be to boost one's self-confidence. Obviously, when you look good, you feel good. So that's one of the reasons. My role in the Chennai plastic surgery team as a psychologist, what I basically do is I talk to the patient about their past. Okay, where they come from, why they want the surgery, what happened in their lives, their experiences. And then I talk to them about their motivation, what actually urges them to have this surgery. Did they have any bad experiences? Did they have any a bad divorce? Did they lose their job? Whatever. And then I identify any psychological issues that they have. A lot of times it's loss of self-esteem that actually works on a patient, okay? They think, okay, if their boyfriend ditched them, they think, okay, they look really bad, they need to, look better to please their boyfriend and they want to have surgery. I think it's a complete wrong reason to have surgery. Anyway, so I also talk to them about, what particular feature in their face or body that they want to change. Many times they want to have some part of their body or face change. That's very normal to the rest of us. But just according to them, it's very abnormal. And the other thing is, sometimes I also talk to them about whether they want to get this particular body feature or facial feature or body change, if it actually causes them pain in their regular day-to-day living. Okay, the next. Another reason is whether it's age-related. As you get older, obviously, all your body parts will begin to sag and everything, and you want to get all that altered. Does it coincide with a divorce? Does it coincide with a rejection of a boyfriend, girlfriend? Does it coincide with the loss of a job? Who are they doing the surgery for? That's one of the main things I talk to patients about. See, the main thing I talk to patients about is who are they doing the surgery for? The motivation behind the surgery is very, very important to me. Because from that I get a lot of information as to whether they actually have to go ahead with the surgery or not. Okay, what my role in this whole, when I gather information from patients, what I basically do is I gather information. The first thing I do is find out from the patient whether they've had medications. It's very, very important to me. Then I also find out if they have any kind of eating disorder, if they have any kind of alcohol or drug abuse, because all these actually precipitate or rather aggravate symptoms after the surgery. So I have to be very careful as far as advising them for cosmetic surgery. And I do psychometric tests. Okay, I also have to find out if they have thought disorders or delusional thinking. This is very important because if they are schizophrenic, I would definitely not advise them to have cosmetic surgery because I know there will be complications once they do have the cosmetic surgery. Okay, see, a lot of people expect a lot from cosmetic surgery. One thing, it's extremely expensive. Okay, now it's become very cost effective. It's much more cheaper to do it in India than abroad. But in general, cosmetic surgery is very expensive. So people expect cosmetic surgery to fix all the other problems. For example, they have self-esteem issues, self-confidence issues, they have varietal conflicts, they have personality conflicts. They expect all that to be filled by cosmetic surgery. That doesn't necessarily happen. The other thing people use surgery for, it's like an easy way out. You can go on drinking excessively, you can eat unhealthy foods, you can avoid working out, but at the end of the day, you have surgery to take care of it, especially if you're rich. The other thing is, people expect, to get a positive reaction from their families. Okay, you know what, I've got surgery done, I'm looking so thin and sexy. No, that's not how people react to cosmetic surgery. It's still in the initial phase. Okay, so people don't react so positively, especially families. So that's the other thing, and they feel very let down when that happens. The other thing is, cosmetic surgery, like I told you, is pretty expensive. You spend a lot of time researching about the surgery, you spend a lot of money, you spend a lot of time. At the end of the day, you expect to come out looking like Marlon Monroe. That doesn't happen. See, if you're a nice looking Sam, you'll be a good looking Sam, but you can't expect to be a stunning Aishwarya Rai. Okay, we are talking about realistic expectations here. Okay, what I basically do when it comes to the cosmetic surgery center is, I deal with people who have unrealistic expectations. Okay, so what I tell them is, see, they're going through the healing process, they're getting over their stitches, the agony of the pain of the surgery. So I have several sessions where I talk to them about, their feelings, how they feel, their unsupportive families, their expectations. Sometimes people, many of the clients do go into depression. They go into social isolation because they don't want people seeing them in their new avatar or their new change features and stuff like that. And then they have a lot of anger. All these are very expected when it comes to cosmetic surgery. And a lot of people have adjustment difficulties. So I deal with all these issues. I have several sessions post-surgery. I talk to them gently. I try to get them comfortable with their new avatars, their new bodies. And this is my role as far as post-surgery goes. At the end of the day, there's no doubt surgery can help us look and feel much better about ourselves. But what I would say is, what is self-image finally? As the word itself says, self. Self is not so much determined about how others think about us, it's about what we think of ourselves. That's about it. Thank you.
Thank you, Dr. Mani Rao. Ladies and gentlemen, I would now like to invite on stage another cosmetic surgeon from Chennai Plastic Surgery. He does wonders to your scalp, restoring hair on scalp for clients with baldness. And this young, talented and experienced gentleman is the best-in-class hair transplant surgeon. Please put your hands together for Dr. Vasan.
Good evening, ladies and gentlemen. I think this should be the last section. Everybody is winding up. I'll finish up within 5 minutes of time. I'll take just 5 minutes. First of all, I thank Dr. Karthik for giving me an opportunity to come and stand in front of you and delivering a lecture. First of all, I would like to go on the hair transplantation for baldness. About 25% of the male population is affected by this baldness, male pattern baldness. The common cause should be the androgenic alopecia. This androgenic alopecia is directly related to the genetic, pedigree and the testosterone hormone. And this is an outward classification for common times. I am not going in detail of this, but briefly I should like to help you out this rough diagram what I have given for you to make you understand. This is of your head top view. and this should be a normal line. Normally, if you have full hair in the head, there should be roughly around 1 lakh to 1.2 lakh hair generally should be present in this area. What the inner line I am drawn here is the one which is the hormonal dependent area, where here the hair roots are of very thin or weak or temporary roots, which directly this hormone, increase in the hormonal level, affects only this part of the hair. Whereas in both the sides and behind, this usually is made up of the thick hair roots, where is the hormone non-dependent area. So usually whoever is bald in the general population, if you see, everybody would have lost hair only in this area. Nobody will lose hair in the sides and behind. So based on this concept, hair transplantation as a whole, the treatment wise,
the wrinkles or even the skin literally hanging down. But most of the people are scared of getting anything done near the eye, which is a sort of a phobia, definitely, because everyone wants vision, definitely. And I can assure you that these cosmetic procedures which we are doing around the eye, which we call it as blepharoplasty, are very, very safe. They do not touch anything of the eyeball, or they do not do anything to the vision. And the ultimate result is not only the field of vision is improved, because the lid skin which is drooping down has been shifted off or removed, but plus the person does feel very good.